Hi, it's Dr. Mache Seibel, and welcome to Ask Dr. Mache. And tonight we are going to be talking about 5 myths busted. 5 menopause myths busted. And I'm very excited to talk with you this evening. For those of you who don't know me, I am a national expert in women's health, women's wellness, and menopause. I am a member of the Harvard faculty and have been for a 20-year member of the Harvard faculty. And I am the author of the book, The Estrogen Window, which is going to actually be coming out in paperback September 19th as The Estrogen Fix. And I'm very passionate about helping women in and around menopause figure it out so they don't have to tough it out. And as I've explained in past Facebook Lives, my interest comes at a personal level because my wife, Dr. Sharon Seibel, was a young woman when the Women's Health Initiative came out, and she 7 months after the Women's Health Initiative came out, the WHI study that incorrectly stated that estrogen caused breast cancer, heart disease, and other conditions, 7 months after that, Sharon had surgery that threw her into early menopause, and her doctors were reluctant to treat her with hormones at that time. And so I switched from being one of the country's leading fertility experts to being one of the country's leading menopause experts, which is what I do now. And actually at Beth Israel Hospital and Harvard Medical School, what I do is train the residents in menopause and see the menopause patients in my program. And of course, I also see patients or see clients that are too far away to come and see me. I do coaching for women at menopausecoaching.com. Well, tonight I want to talk to you about something I think is very important. It's called 5 Myths Busted, 5 Menopause Myths Busted. And I want to hop right in on this because I think it's a really important topic because there's so many misconceptions, or I call them myth conceptions about menopause. And the first one I want to talk about is that menopause starts in your 50s. I don't know if you think menopause starts in your 50s or not. If you think menopause starts in your 50s, let me know. Say yes. And let's talk about that because the mean age of menopause actually is 52. And it turns out that the definition of natural menopause is 1 year after your last period ends. After you have your last period, 1 year later is the definition of menopause. And it does turn out that it happens at about age 52 in the United States, but the range is about 46 to about 55. But 5 to 10% of women go into menopause under the age of 45. In other words, between 40 and 45, 1 in 100 goes into menopause before age 40. 1 in 1,000 goes into menopause before age 30. That's a lot of women. So menopause does not start in your 50s for everyone, although it can. And the symptoms for menopause can start up to 10 years before that. So that's myth number 1 busted. Myth number 2 has to do with hot flashes are the first sign of menopause. And as a result, a lot of people think, oh, if I don't have hot flashes, I can't be in menopause, or they don't have it. But in fact, about 25% of women won't have hot flashes. On the other hand, about 15 to 20% of women are going to have severe hot flashes that are terrible and very embarrassing, very life-affecting. So the thing is this, is that other symptoms can come first. Fatigue, for instance. Irregular cycles are very common. The third myth is that your mojo will be a no-show. In other words, sex drive just goes out the window. Well, for some women that can be true. For some people that can be a problem. But it doesn't have to be that way, and as a matter of fact, for some women, sex will even improve. So sex drive can be really something that depends on your information, it depends on your treatment, and if you get the knowledge and wisdom and experience that you need told to you, then libido does not have to get bad in menopause. Myth number 4, your body will gain weight. Well, it's true that many women do gain weight. As a matter of fact, it's one of the most common things I hear about. And they'll tell me, oh, I go into the closet, I have a wardrobe that's all one size too small, or I can't zip up my pants, or I'm getting a jelly belly, and so forth. But the fact of the matter is, it doesn't have to be like that. And again, with the right information, many women can control their weight and stay pretty much the same weight. It's true there's some shift in weight, so there may be a little bit more belly fat, particularly if you're not on hormones, because hormones can help to keep the fat where it's at, and a lack of hormones can cause fat to migrate to the belly and cause that jelly belly, that menopause that women talk about. So that can be an issue. But it doesn't have to be an automatic weight gain. Aging can cause a weight gain if you continue to eat the same amounts, because our metabolism slows down every decade about 3%, but doesn't have to be. And finally, number 5 is that bioidentical or compounded hormones are safer than the standard drugstore hormones. And this is a fascinating topic because just yesterday there was a preprint of a new article, the latest article, talking about hormone therapy, and it turns out that it's absolutely not the case. The problem is that there's a lot of misinformation on the internet. And it talked about that there was a study that came out looking at 100 of the top websites that are selling bioidentical hormones, compounded hormones, saying that they are safer. They're not. Saying that they help prevent breast cancer. They don't. And saying that they are in some ways more natural than the standard drugstore hormones. That isn't true either. As a matter of fact, the only plant that hormones can come from that are effective in the body is from the chemical plant, and our body doesn't have the enzymes to process those things, the precursor hormones into hormones. So those are 5 myths that I wanted to share with you at this time, and I wanted to open this up to you to questions. If you have any, I'd like to address them because, as you know, the average visit to the doctor is about 8 minutes. Most people don't get a chance to ask the questions that they want, and I want to give you the opportunity to ask some questions and to get some answers that can help you. Because one of the things that this article in the journal Menopause, the Journal of the North American Menopause Society, talked about was that, my goodness, they said many women are disappointed when they go to their doctor. They don't get the right information. They don't get enough information. They don't get their questions answered. Their doctors don't ask them if they're taking hormones from the compounding pharmacy. There's basically a disconnect. And it talked about how pharmacists, the Canadian pharmacists in particular, they talked about, but they were saying how the pharmacists, 75%, didn't realize that bioidentical hormones are available both in compounding pharmacies and in the traditional drugstores. And that's a real big issue. And also there was a misconception about safety. And as far as doctors and nurse practitioners and NPs and PAs and all the other letters that happen, DOs, it turns out that only about 45% are prescribing bioidentical or compounded hormones. Either way, most of those were not comfortable discussing them with patients. They weren't sure they had the information they needed. And that's one of the reasons I went ahead and became a NAMS, or North American Menopause Certified menopause practitioner, just to demonstrate particular proficiency. But having done this for the last 30 plus years, I've seen over 10,000 patients, and the nice thing about that is every woman is unique, has had her own experiences, and everyone brings a little something different that has to be figured out for her. So, this is from Diana. Diana, hi, nice to have you and nice to join. She says, the itching is driving me crazy. Well, I hate to ask a silly question, but where is it itching? Because that could be a very different situation. Itching on the skin in general is not uncommon in menopause from two different things. One is that as estrogen gets lower, it causes very dry skin, and dry skin can lead to itching and irritability. But also some people have sensations that they feel that are like crawling and other things, and that's a specific condition that is available. And of course there can be itching down below in certain private parts, and that is a different issue that can also be caused by dryness, but also vaginal infection. But Diane is saying she itches everywhere. So some of that, depending on the nature of it, can be due to dry skin. Some of it can be to low hormones. And some of it can be a special condition of feeling like things are crawling and itchy and so forth. And if that is the case, there are different kinds of medical treatments for that. That's something to talk about with your healthcare provider, because there are definitely treatments. I mean, you can of course start off with lotion moisturizers and things like that, but it can be a hormonal issue, and it can be due to other sensations that happen more frequently around the time of menopause. So just talk with your healthcare provider about it, because that is treatable and something you categorically need to get taken care of, because, you know, itching can make you crazy. And what happens when you itch is, what do? You scratch. And people that itch at night in their sleep, they scratch in their sleep. And what does that do? Well, the itching, the scratching releases histamine in the skin. That leads to more itching. That leads to more scratching. And then that leads to just a big cycle, and then the tissues get thicker and so forth where you scratch. So it's very important to get to the bottom of that and take care of it. But the good news is lots of treatments for itching, and just talk with your healthcare provider about it. The other thing it could be, of course, is you could be allergic to something. And if you have an allergy, you know, it could be to a food, it could be to a new detergent that you're changed in your laundry, it could be to the suntan lotion you're putting on, it could be to a lot of things. But check this out. Don't suffer. Get it taken care of. Other questions? Looking forward to hearing what you have to say and trying to address those. You know, if you are wondering about menopause, where you are in it, and if you're in menopause, you can always take the Menopause Quiz. You can go to menopausequiz.com, and there I have a free quiz for you. It asks questions about the most common symptoms of menopause and gives you a score that's immediate and tells you how much menopause is affecting your life, and it also gives you some tips on how to deal with the ones that are bothering you the most. Again, it's pretty straightforward. menopausequiz.com. Other things that you would like to know, I'm here to help you. I'm here to answer your questions and to be of assistance in any way that I can. One of the things I've always wanted to know is what you want to know, because if I have the opportunity to have a heads up on the issues that worry you, I'd love to be able to address them and to help you. Samantha, hello. How are you? Thank you for joining. Should every woman be on hormones in menopause? That's a really good question. And the answer is, depends. Like all medical questions, it depends. Now here's the fact of the matter. The majority of women will be benefited by being on hormones. The majority. And the thing is that it all depends on several things. Your particular history. It depends on your fears, desires, wants, specific needs. And it depends on when you take the hormones. because there is this thing called the estrogen window, and that's the window of opportunity to start hormones. It's different for different organs, whether it's your skin or your brain or your breast or your bladder or your bones, all a little different, but in general, you want to try to start hormones if you can closest to menopause. And if you do that, and if you are not someone who is unable to take them for a medical reason, contraindication, a reason that you shouldn't be taking them, if that's your situation, the majority of women are going to get much more benefit than they are risk. Having said that, when we talk about any medicine that you take, you have to realize that, whether or not you take a medication, for instance, some women will have breast cancer. Unfortunately, it's true. Some will have blood clots. Some will have whatever the medical heart attacks, etc., etc. The question is, does the medicine you're talking about increase that risk over what would have happened anyway? That's the question. And the answer is the majority of women, unless they have a reason not to, if they started in their estrogen window, will benefit. So that's the general answer. And of course, that's the kind of information that I'm always asked about when I see patients at Beth Israel Hospital at Harvard here in Boston, and also when women call me for coaching at menopausecoaching.com. I have room for only a limited number of people from around the country, or actually around the world, and people will call up and see if there's a fit for them at menopausecoaching.com. Okay, Samantha, thank you. And thank you for your question. I always appreciate the questions. It takes courage to get out there and ask these questions. But let me tell you how awesome this is, because in the office setting, as I said, you typically only get about 8 minutes of time. Half of that time you're going to be, answering the basic questions, and you're going to be getting examined, et cetera, et cetera. When are you going to ask your questions? And here you have this opportunity to just fire away. So if there's anything I can do to help, let me know. Samantha says, I appreciate your time, and I appreciate your time too, Samantha. Thank you for joining me here. And we're here every Thursday night at 9 o'clock. And, make sure that you follow and that you are actively part of the community, so that I can let you know when other things come up, and share this. If you've got girlfriends who might be interested, share this with them. Be sure to share it with your friends. Bring something to sip on and just prop up your feet and enjoy yourself for a few minutes and get the information that you deserve and that you want, because so many women are doing without the information. That was what was so amazing about this article in the journal Menopause today. It talked about how many women are not getting the information they want. They're struggling. They're trying to figure it out. They have symptoms. They don't know what to do. The choices are confusing. And there they are. There you are, trying to sort all this out. It seems like you're on your own, sometimes getting misinformation, sometimes getting no information, and sometimes getting wrong information. So, goodness. Yes, Samantha, you're saying that there's so much information out there and it's very confusing. It is confusing. And the reason it's confusing is because there's been some really big articles that turned out to be wrong. They got into the press. The press does a great job most of the time, but sometimes the information is, reported in a way that it's confusing. And then as the truth comes out, the details come out, the nuance comes out, it's like a retraction. So you had the big headline, and then you have the little fine print for the retractions where they say, well, here's what really happened, here's what really happened. And that's why I spend so much time reading all these things. And also, as editor of Hot Years Magazine, hotyearsmag.com, I interviewed the people that do these studies from around the world and make it available to you at hotyearsmag.com. And I talk to these people about the studies, and I say, oh, come on, is that really the way it is? Is it true? Is it accurate? And then by the end of it, I get a real three-dimensional look at things, and I try to bring that to you in blog posts on my site, drmache.com. This is Ask Dr. Mache at drmache.com. You can follow me there on my blog and many other things. Samantha says, bioidentical hormones versus synthetic. Having a hard time figuring out what's best. Okay, here's the story on that in a nutshell, because it's a long conversation. But bioidentical means that the shape of the estrogen is exactly identical to the estrogen that you make. That's what it means, bioidentical. Now, bioidentical are synthetic. They're synthetic because they have to be produced in a chemical plant. That's the only plant that hormones come from, the chemical plant. Even though they may start with a soy plant or a yam or something else, the only way they can be manufactured is through a chemical plant. Now, bioidentical has the same structure, synthetic ones, bioidentical, but people confuse bioidentical with compounded, and compounded are the ones that are made in compounding pharmacies versus the ones that are in the typical drugstores. Now, there are these other kinds of synthetic ones, for instance, the conjugated estrogens, and that's the ones like Premarin, the ones that get the bad press because they come from horse urine, pregnant mare urine, or Premarin. But that hormone has a different chemical structure, but it is the most studied hormone in the world. And in fact, when taken in dosages that are comparable, is as safe as the bioidentical. But none of them are natural, and all of them in comparable dosages can be safer. There's some benefits in taking topical versus oral. In general, the topical ones, whether it's a patch or whether it's a cream or whatever it is, can be a little bit lower risk of blood clot. So Samantha, that's it has to be more catered to you specifically, but in the thumbnail, that is the kind of the 411 on it in the quick explanation. Other comments or other questions, because I love to tell you about it. I know that hot flashes are a big issue for so many women, and because they are, it's one of the commonest questions I get. It was one of the 5 myths. Hot flashes aren't necessarily the first sign, but they can really drive you crazy. They can keep you up at night. They can affect your sleep. They can make you embarrassed when it happens in front of people. Samantha, you are welcome. They can make so many effects on people. So I have created a hot flash rescue kit, and I have made it available. We've just launched this and made it available for under $20. You can get this entire kit online course, and in less than an hour, you can figure out how to cool down those hot flashes. So Diana says, yep, and she's got about 4 bonfires going over there. My goodness. So I know it's a big problem for women, and it's kind of like, here's what I do. I go to the movies, I go to, groups where people are, just in the general venue, and I see somebody doing like this. You ever go someplace, you see somebody doing like this? Yeah, so there's a lot of fanning going on. But the Hot Flash Rescue Kit, available at hotflashrescuekit.com, can help you with that. Oh, I see somebody I know there just joined. Hello, how are you, Nina? Nice to see you, and I hope things are going well. See, Nina's in Florida, and it's always hot in Florida. Even in the winter, it's hot in Florida. But if you do suffer from hot flashes, check out hotflashrescuekit.com. If you have any other questions, I'd like to be able to join them. We have just a couple of minutes left, and I'd like to serve you as much as I can to give you information that would be helpful to you. So please share your questions now. Please also follow on this and share these posts, because I really want to help as many women as I can. That's my whole purpose. As I said to you, when my wife went into early menopause shortly after the Women's Health Initiative and people were reluctant to treat her, I realized that women really do suffer and need help, and they need to get accurate information. And again, as I said at the beginning, there are women who that are not getting the information, and an article came out just yesterday morning talking about the confusion, the lack of information, how the medical community is still trying to understand hormone therapy, which makes it hard for you because you're going to the medical community for information, and some of the doctors are more knowledgeable than others. And this is a very, very, very confusing subject. So we have time for a last question if you have one. In the meantime, I hope you will share this post. I hope you will tell your friends, and I hope you will join me each week, 9 o'clock Eastern, 9 o'clock p.m. Eastern on Thursdays, and follow and let me give you this information each week, and then at other times too when new articles or other things come out, because that is my hope and is to help you figure it out so you won't have to tough it out. Last questions. All right then, I want to thank you so much for joining me, and you can tell your friends, as I said. You check out, I have in the posting up above, we have hotflashrescuekit.com. Go and check that out. In less than an hour, you can cool down those hot flashes. And Diana, you can take care of that and help yourself, and let your friends know that we're here every week, 9 p.m. Eastern on Thursday nights and other times. In the meantime, I look forward to seeing you at the next Facebook Live. Stay well.